Hey y'all, it's Alex here with Healthier Democracy, here to talk with you today about those pretty cool robots doing ultrasound in Alabama that you might have heard about from Dr. Oz. But providers on the ground aren't calling them pretty cool. Now, Alabama has been in a maternal mortality crisis much higher than the rest of our nation's own maternal mortality crisis. Their infant mortality rate is at 7.1 per 1,000 live births, when the national average is about 5.5. And in fact, only 15 of their 55 counties have hospital based obstetric care. It used to be 40 counties back in 1980, so there's been a lot of closures since then. So, as part of the Rural Health Transformation Program, the Alabama applied for the robots that are about $300,000 to be able to do abdominal only ultrasounds on pregnant patients so that they don't have to drive for hours for every single prenatal appointment, which could be every week or every other week, depending on their situation. However, these robots are expensive. They can only do abdominal ultrasounds, and so they can't do some of those more invasive ultrasounds we do a lot of the times in early pregnancy. And these high risk obstetric providers are worried that many pregnant patients won't get flagged as high risk early on or won't have as much symptom management when they only go in for an ultrasound with a robot. Now, other places across the world have been experimenting with pregnancy ultrasounds with robots, but they're always being overseen by a trained professional. So it's not really removing any issues when it comes in terms of staffing availability. Alabama's trying to find creative ways to address the maternal mortality gap, and we might be able to translate this to other places, but so far, we don't know that this is the right answer. And it's a very costly answer that could actually exacerbate outcomes. So keep an eye on Alabama as more of this unfolds.